Obamacare required insurance companies to spend 80 cents on every dollar on healthcare. The managers of the insurance companies got very angry. They're like, well, how are we going to, maintain our salary? The plan that they came up with was to just charge more for everything in healthcare.
Welcome back, everyone. This year, health insurance costs will be going up.
What is really going on with healthcare costs?
It comes as health insurance costs are rising significantly throughout the country.
Premium costs across the board are going up, and it's impacting almost everyone.
In the Senate, you kind of get free reign. These large, sweeping pieces of policy that Republicans want don't even get a hearing. My number one job is to pick up seats.
It makes so much money for the state that it's a no-brainer for the state, and it should be enough to fund not just the governor's campaign, but all the downstream candidates too. All right, I'm Dr. Ori Nagy with the Ori Nagy Show. Thanks so much for tuning in today. I'm running for Congress in Nevada's 3rd Congressional District, and today I am with Danielle Gallant, who is running for State Senate in State Senate
SD20.
SD20.
Yeah.
Who is a 2-term assemblywoman from Nevada's 23rd Assembly District.
Yep, that's correct. Yeah. So super excited about this new opportunity. But it's a big district, so I'm going to be putting a lot of miles on my car.
Well, tell us the boundaries for your district.
So it goes from Laughlin to Mesquite.
Okay.
And up through the Moapa Valley, and then it jumps over like that Green Valley, McDonald Ranch area, skips that, and goes over to Anthem, Seven Hills, and Inspirata.
Okay.
Yeah.
Okay. So a lot of Nevadas are going to be in your district.
Yes. It's interesting. We were pulling the numbers the other day, and I have one of the largest active voter bases.
Nice.
So over 126,000 active voters.
That's a big district.
It's a big district. Yeah. It also means an expensive race. How's their race going?
It seems to be going really well. I get a lot of positive feedback when I go out, when we have our little coffees with the candidate. We always get 20, 30 people come out, and, and they all seem to go, well, yeah, we're going to vote for you. So that's always great.
Good.
And we got a lot of positive feedback when I was in D.C. We met with 3 congressmen over there, a bunch of lobbyists. I had another conversation with a congressman this morning.
Okay.
And I think they like the healthcare plan that we're putting out. It's a rational response to the single payer plan the Democrats are putting out. Okay. This is instead of getting more government involved to reduce quality and increase prices, we're putting private enterprise back in a way that makes sense. And we're utilizing mutual insurance companies.
Have I talked to you about this before? I don't think so. As somebody who's self-employed, my options for health insurance is pretty limited. When you take a look at like price and the deductibles and things like that. So I'm going to do a shameless plug, but we use Redirect Health, which is a physicians healthcare network.
Okay.
It was a bunch of physicians that started it. And it is an HMO, so you have to ask for permission, which I've never used before. I don't like doing that. But they have an app. And I tell them when my appointment is and where I'm going. And if that particular physician is not in network, they call them. They get them in network 100% of the time and shepherd the entire process. Their customer service is like just amazing. Every time I talk to somebody, it is like I am in Candyland. They are so nice.
Yep.
They are very helpful. And I have I never thought the words would come out of my mouth. I love my health insurance.
Wow. This is it's local doctor there,
Nick Goodenall. And it's through my company. So they allow like my husband and I to be employees, how they work it. And then we have the kids on it as well. And I've just been blown away with the service that I get from them. So
what's the newest company?
It's Redirect Health. And
Redirect
it's
Health.
Physician Health Care Network. And they have never, ever denied one claim.
That is outstanding.
It's outstanding.
Yeah, and I'm really happy to hear that. Right now, there is so much bloat in the health insurance industry.
Mm-hmm.
So it doesn't surprise me that, the doctors who know what the proper health care is are able to remove all that bloat and just get back to the business of providing care.
A perfect example, my 10-year-old, about once a year, we end up in the emergency room because at about 2:00 in the morning, he can't breathe and we can't get him under control. Okay. So I am very good. It's the same treatment, right? The nebulizing treatment, steroids, monitor, and then a couple hours and then off we go home. Okay. It costs me anywhere between $2,000 to $3,000 every time I go for one of these appointments. Okay. Well, we had to go to like more of a rural hospital. And the last time we did it, and again, I'm like, okay, that's $2,000, right? Well, the girl didn't take my health insurance down properly. So they sent me a bill saying if you want to do private pay, like $637.
Yeah.
And I thought, what? And then I sat there and I thought, do I just pay it? Or do I take the risk of sending it over to my insurance and it costing me more money? Because you hear about those stories.
For sure would. Yeah.
I ended up deciding to go ahead and send it over, right? And then all of a sudden the bill went up to $3,000.
Yeah. So the game the insurance companies plan, the way that I explain to people is when Obamacare went into effect, Obamacare required insurance companies to spend 80 cents on every dollar on healthcare. Before that, they would spend 40 cents or maybe 60 cents at most on healthcare, and they keep the rest for, internal salaries and profits. So once 80 cents were being required, the managers of the insurance companies got very angry. They're like, well, how are we going to, maintain our salaries and this kind of thing? And so the plan that they came up with was to just charge more for everything in healthcare and vertically integrate and buy up the doctors' practices in the hospitals.
The PBMs, the pharmaceutical companies, yes.
And so what they end up doing is if there's a drug that costs $5, the pharmacy would normally sell this drug for $5. The insurance company will go and talk to them and say, you need to charge $200 for this $500 drug. And so now the insurance company can show they spent $200 on that drug. On the backside, they tell that person, but you're going to need to pay me now $180 as a reimbursement. If that doesn't show up on their overall expenditures budget, and so now they get back that 180, and they say the patient's going to pay you $20. So the pharmacy now just got $20 for a drug they would have sold at profit for $5. So the whole of the system has been incredibly bloated in order to ensure the insurance companies continue to make the same amount of profits they want to. Completely unnecessary. And so you're seeing a version in the hospital side.
Okay.
It's very disturbing. It's very evil, and it needs to be undone.
Yeah.
So the best pathway forward is to switch the structure of insurance company work within the country from these publicly traded firms that have only one master, and that's profit, back to mutual insurance companies. Mutual insurance company is owned by the policyholders, the patients. So the CEO in that structure is accountable. If they deny appropriate care, they get fired. And if they're, running weird games like this, they get fired by the people who own the company. And when a mutual insurance company makes a profit, they pay out dividends to the shareholders.
It's like your credit union structure.
It is.
Okay.
So then the next year, instead of taking a bunch of money just at the end of the year to get it back to everybody, they just lower their premiums. So in the current model, you see the premiums rise every year.
Constantly.
In the mutual insurance company model, you can see that the premiums start to fall.
That's a great idea.
Yeah. So every state has the ability to pass laws to license insurance agents and to write permits for insurance companies. So they can pass laws that incentivize mutual insurance companies and disincentivize publicly traded firms. Mm-hmm. And if the mutual insurance companies are making a lot money, they're typically local entities. So that means that the hundreds of millions of dollars that are being siphoned out of Nevada go to Wall Street and profits to these insurance companies. Well, instead, all stay here and recirculate in our state. So instead of going to shareholders in China, Russia, Saudi Arabia, and the central banks of Europe, hundreds of millions of dollars stay here, recirculate in our economy, and everybody is better off.
Yeah.
Because if everybody here has more money, what goes into the banks, and the banks have more money, so they want to lend it out more, so interest rates fall. And that means that more business loans are created, more businesses are started, and more construction happens, more people buying homes. It's the whole economy takes off at this rate. So this is all about fixing healthcare.
And Nevada is now #1 for small business owners now. I don't know. That's what that. Yeah. He's doing a good job. He's doing a good job. And, it'll just, it's a snowball effect if we're able to implement some more of these changes.
Yeah. Yeah. It's a really great thing.
Cool.
So what are you going to focus on when you're up in the Senate? How is that different from being in the Assembly?
Well, there's less personalities to have to deal with when you're in the Senate. So your vote counts more. When you've got in the Assembly, if you have, 13, 14 people in a committee, not everybody's vote matters, right? Okay. But when you have a committee of 5, now your vote matters.
Okay.
So it's just a numbers game. So that's part of it. But I was joking the other day with somebody because in the Assembly, typically in the hearings, it's one question per bill that you're hearing because there's so many people, you kind of have to manage the time.
Okay.
In the Senate, you kind of get a free range. Like it's just expected for you to get follow-up questions. So you would think because of the Senate that there's less people, it would go faster, but the hearings are longer. 4 sessions are longer because people are allowed to express their ideas and their thoughts and their opinions more. So that it's a little bit of a trade-off, right? It is interesting. Everybody always asks, and I have voters ask me this all the time, like, what's going to be, how are you going to fight for us in person? Like, what bills are you going to pass? And the way the dynamics are is that we are in the minority. And so these like large sweeping pieces of policy that Republicans want don't even get a hearing.
Yes.
Right? School choice, voter ID, that's why I had to put it on the ballot, election reform, even, when we're talking about like trying to do some reforms in terms of like, economic growth and building, right? And reducing some of those regulations. You just don't get hearings on those. They just like put it at the pile and it dies within the first, few days of session. So I've always been very like strategic in terms of the bills that I carry. I take a look at like what has the possibility of getting a hearing, and they're not going to be huge sweeping policy changes, but they're incremental. So I think that's important for a couple reasons. One, you want to be realistic when you go in there, particularly as a Republican. And 2, it helps to build relationships, right? I'm only 2 sessions into it. I've got hopefully this third one coming up, and my relationships are getting better and stronger with across the aisle and my Republican colleagues.
That's true.
So that helps you get, kind of bigger legislation passed down the road. And then I also tell everybody, like, my number one job is to pick up seats. And so we're not going to be able to pass any like amazing like legislation, right? These big policy changes that we'd like to see here until we get more Republicans. So that's where most of my efforts have always been. So particularly last session or last cycle, I mentored 6 assembly candidates. I knocked doors for them on a daily basis.
Wow.
I gave 90% of the money that I raised to these candidates. And, I was looking forward to being able to do that again this cycle. I'm lucky my race is won in the primary.
That's good.
But unfortunately, I do have a primary opponent.
Did you really?
I do. And it's, just going to make the race more expensive.
Yes.
And it also means that like my resources that I raise, I need to put it towards my primary race at this point in time. And I'm probably not going to have as many funds to be able to help those candidates in those swing districts in the primary or in the general, excuse me. So, it's okay. Once I win this race, I'll have, moving forward in the subsequent races, like I will have that ability to do that, and I will continue to do that.
One of the things you're seeing here in the state is a lot of people are leaving the Democratic Party and are becoming Republicans. And as we see that happening, I think that's going to mean there's more money that's going to be shifting into the Republican side.
It has been. I mean, we definitely saw an influx of money for our Republicans last cycle. The governor has done like an amazing job in building like a robust election team and structure and strategy. There was a lot of successes last cycle. There was some things that needed to be improved. They've improved upon it this cycle. And so I think every year this Lombardo machine, which they, we relate to the Reed machine, it's getting stronger and more robust and better. Yeah.
He's a very capable human being, is what I'm doing.
He is. And he cares.
Yes. Yeah. And that really comes across.
Yeah.
How he communicates and just in the way he deals with people.
Yeah.
He seems to be very good, man.
He's very loyal.
Yeah.
Which is like nice. It's nice to have. Like he's not fickle. And he really is very thoughtful and takes time to touch base with, his colleagues. I mean, during session, he and I had coffee twice. Once because I requested it and it was like within a couple days, and then another time because he requested it because he needed we needed to touch base about an issue and he wanted to have a thoughtful conversation. And so I really appreciate that he takes the time with the various legislators to have some one-on-one and some real conversations.
That is a good thing. Yeah, he was he made some time for me about 2 months ago.
Yeah.
And we sat down and I kind of went through the healthcare plan that I sort of outlined here for you.
Yeah.
And he kind of listened thoughtfully. He'd been hearing from a lot of other big burn communities I've been putting out there. And he was supportive, I think. He didn't commit because, he's got to hear it's a complicated thing and it's going to take a lot to figure out how to implement.
Yeah.
But he could see the logic to it. And he was happy to hear that Andy Bates, who I presented it to, who's running for governor of Arizona,
Yeah.
was in favor. Because I'd gone to the Arizona Republican Party, their major event for the year.
Okay.
And I chased Andy Biggs around. We got to advocate, right? So when I finally cornered him and he had to listen to the thing, he was like, okay. But 20 minutes later, he circled back. He's like, actually, that makes a lot of sense. And, I want to talk some more about that because I think that would work.
So it had to percolate a little bit, huh?
Yeah. It's not straightforward. But yeah, because the way that it works is it makes so much money for the state that it's a no-brainer for the state. But the entities that are involved, the mutual insurance companies that get stood up because of it, they're going to become influential and wealthy, and the agents who get to sell the insurance for them.
Yeah.
As every employer in the state transfers their plans through those agents to the individual, will become very wealthy.
Yeah.
And those guys, you have to pick those agents very carefully. Typically, you're going to choose the agents who are the presidents of the chambers of commerce, because those people can move lots of votes and lots of donor dollars. And it should be enough to fund not just the governor's campaign, but all the downstream candidates too. So we think this can be a very successful tactic to helping really red states all over the country.
Amazing.
So yeah, we're this can succeed.
So let me ask you another question, or I want to delve into this healthcare thing. So I think there seems to be a major movement towards preventative health, right? So I was a marriage and family therapist ages ago. Okay. I'm a marriage and family therapist, and I did my residency, my internship with Emory University, or clinic. It's school. It's an excellent school. They partnered with Auburn because that's where I was at the time. Nice. And, in terms of working at these family practices and having people come in with these healthcare issues that are behaviorally caused for most part, right? Bad diet, poor exercise, things like that. Okay. And sitting and talking to the residents, what about prescribing walking or eating right? And they go, they just won't do it. And so there was this culture of pushing pills, right? Now, 20 years later, we're turning into a culture of preventative. Moms, my generation of moms, right? We are okay. And it's funny, my mom taught me this. She's 82 and she taught me this. When you go to the grocery store, you shop the outside aisles.
Okay.
That's all your fresh food.
That's true.
Okay. Stay away from the middle aisles.
Oh, wow. That's interesting. She's right.
She's totally right. Okay. So that's how I've always operated, right? We spend most of our time in the outside aisles. I have 2 boys, so there is some stuff that I let them get but I don't have an appetite for it. I just don't have a taste for it. So, very healthy food. And to the point now, I don't even buy shredded cheese. I shred it myself. Right? Everybody's like, oh, what a pain in the butt. I'm like, trust me, there's tools out there. It makes it easy. Okay. And then also taking a look at these, what they're talking about biohacking with the various peptides, right? They're short chain amino acids. The side effects are minimal other than the GLP-1s from what I've read. You probably know more about it than I do. And then even the stem cell, we don't have you got to go down in Mexico to get the robust stem cells for treatment. And it's why are we so behind on actually coming to the table with things that actually heal our ailments rather than putting a Band-Aid on them like pills or back surgery, which doesn't work.
Well, it does work for a lot of patients.
It does, but you don't my friends have been blown up by, IEDs in Afghanistan. Surgery is not going to help these guys, but the stem cell stuff does. But, a lot of the times, okay, when they get it's 50-50 whether those surgeries are going to be, that's
there was a time where that was fairly accurate. Yeah.
Okay. And so when are we going to start, coming to the table with, I know they sound alternative, but there's a ton of research around it, and bring it to the States so that we can have insurance cover this. Because to go down to Mexico to get that stem cell is 30 grand, right? And, that's a huge chunk of change.
Absolutely.
Or even like the guys that are going down to Mexico for PTSD and they're doing heroic doses of ibogaine and coming home and are good for years and never have to take another pill.
Yeah.
I'd love to hear your thoughts about that, and if you think like as a country we can move towards these alternative.
So first, you're right in this understanding of what good medicine is now.
Yeah.
And that the peptides and the improvement in diet and overall health, that is accurate. That is the right way to go. It is hard for doctors to change. So I had started to follow this revolution understanding metabolic syndrome and the cause of type 2 diabetes and get around it, and how to improve diet to improve health with intermittent fasting and switching to a keto diet instead of a high carbohydrate diet. And when I tried to get the Clark County Medical Society to adopt policies that are, science-based and common sense if you keep up with what's going on, I met with tremendous resistance. There were 40 people there. There was one person who sided with me in that room. Now, all the science is I'm 100% right in what I was saying. But to get people to change the way that they do things is very difficult. And the reason is because the way the doctors are trained is, we like to be 100% certain when we do things.
The human body is not certain.
And yet, they like to be 100% certain that the information they're getting you is correct, because then they can go home confident that they've done the right thing for all their patients, that they made no errors, that they're not going to be, someday medical liability, that too. But also, just on a personal level, they want to know that what they did was right. And so there are a couple different ways to go through medical school. But two ways that stand out is one way is where you sort of sit and you understand everything for the molecules on up, and that take very time consuming, very difficult to do it that way. The other way is you just brute force memorize everything. So lots of stuff we don't understand medicine, you just have to brute force memorize that and say these are the answers.
Yeah.
And for people who choose that path, it becomes a significant commitment, time commitment, to unlearn something that was the pathway and then to relearn something else. So they don't want to commit the time to that until they have, a mountain of evidence that says, this is the right way to do it.
Yeah.
So that makes them inflexible, and it makes it difficult for them to absorb new information into the way that they do things.
Interesting.
And this is, it seems to me, there are a very large number of doctors who are this way. But how do we get from where we are today to the optimal, where we're rapidly adopting the newest technologies that are out there as soon as you recognize that they're providing an advantage? Because that's where we'd like to be.
Yeah.
So one thing that we're doing is we have recognized, interestingly, that the stuff that you're talking about is sort of the anti-aging space.
Yeah.
And the improved biohacking and sort of the MAHA movement.
Yes.
So the MAHA movement is pushing us in that direction. I'm a big proponent of what those guys are doing. I was doing some of that stuff before RFK was able to start pushing it up there. We a few years ago we started this process of this Nevada Nutrition Coalition, and the idea was that we recognized that here in Las Vegas we have the best chefs in the world. We have the freshest food shipped in every morning. We have some of the best nutritionists in the country at the UFC, the NFL, the NHL, the WNBA. We have all the tools we need to provide the most nutritious, delicious meals in the country to the kids in our schools, but we're not doing that right.
Mm-hmm.
And so we set out to start to figure out, how can we implement these resources that we have to optimize outcomes here. And so we got the former president of the school board, a current member of the school board, president of the Nevada Association of School Administrators, one of the largest food producers on the Strip, produces for the Bellagio and for the Wynn, the head nutritionist at UNLV, the head nutritionist for the NFL, and the head meal preparations and nutrition for the Golden Knights for the immediate past one. The head of epidemiology at UNLV, the head of public health at UNR, the head of biostatistics at Touro University, the head of nutrition and epidemiology at Roseman University.
Okay.
And the idea was that we could prove that we had that if we improve the diet slightly and provide kids in our schools, we could reduce diabetes, obesity, and overall health problems, improve academic performance, athletic performance, reduce mood disorders, suicides, school violence, teacher assaults, and school shootings.
Wow.
We could prove it, and that in 2 years after we've published the data that shows that, 49 other states in the country are going to want to copy what we just did here, and all the vendors and all of the consultants who will participate in that will have huge demand all over the country, and that'll make a lot of money for Nevada.
Yeah.
And we can do all this because right now it's about $6 a meal. In our state, we have the 5th biggest school district in the country.
Yeah.
They serve about 330,000 meals a day, and so that's a huge captive market, which allows us to build economies of scale for new nutritional products.
Yeah.
So we can utilize allulose or inulin. These are things that lower the glycemic index instead of increasing it. And just by introducing those two things, I think we could significantly reduce and tackle obesity. So we want to take the current version of the food pyramid that RFK put out.
Flip it.
Yeah, I know, right? He's just sort of trying to have, oh, genius. All right, but
I mean, RFK's is good. I just threw the one I grew up on. We should just flip it.
that is exactly exactly. But we want to make a 5 to 10% improvement on that.
Okay.
If we do that much, and we get enough of nutritionists to agree, that's where we're at right now. We're trying to get the nutritionists to agree that this much just constitutes 10% improvement.
Yeah.
Then we can start to implement that in the schools out here, and finally, we met with the folks at the school district. So we met with the head nutritionist and the head of purchasing, and we put it to them that every person in the state of Nevada is aligned with you in your mission to provide the most nutritious, delicious meals in the possible to our kids.
Yeah.
So there is no resource available to our state that is not at your disposal to help you succeed in your mission. What do you need?
Yeah.
And when we put it to them that way, they said, okay, we can open this up and we can put an RFP out for improved nutrition products we put through. So we went to the biggest food producer and we're going to ask them to provide the backstop.
Yeah.
And then we want to go to any food vendor in the state who can produce meals at that standard that we're talking about.
Yeah.
And if they can meet those standards, and we have some guys who worked in food for a long time to go out and, inspect all the sites to make sure that every 3 months they're still up to speed. They're not feeding kids sawdust. Yeah, it's important to make sure.
Yeah.
Everybody's getting poisoned.
Yeah.
If right now the school just does a great job, everybody's getting food poisoning in the schools, right? They're all hot meals on time. People to do 330,000 meals a day.
Yeah.
So we want to open this up to a lot of new businesses in the state, and so this is a way to improve healthcare.
Yeah.
Where we start.
But that's where we and I think even we're so focused on. So I have my youngest has allergies, right? Mild, thank goodness. But when he was 1, he kept throwing up when he drank milk.
Oh.
Okay, so we took him to the allergist, and they're like, "Oh, he's allergic to dairy." Now, mind you, I do home births with both my kids. So I went to my midwife. I call her and I'm like, does this make sense? And she goes, kids are not allergic to dairy. It's very rare. Okay. And she goes, he's allergic to how they process it. And what happens is when you do that allergy testing, they test for the types of foods that we have access to. Okay. So the milk that I buy organic, it's chemically everything good and bad is taken out, and then they chemically put the good stuff in. They don't heat up the milk the old-fashioned way and pasteurize it that way. So at the time, this was 10 years ago, Winder's Farm was delivering right in the glass. Okay, never had a problem with that kid. So now I have an allergist telling me he has a dairy allergy, but with Winder's Farm, it was fine. And I think we have to really take a look at. Yes, I understand that we make food that lasts longer on our shelves, but is it really good for us to put that in our body?
And so this is a huge battle that's going to take place in our country.
Yeah.
Between the people who are manufacturing these food products,
Yes,
and the people who are trying to make them healthier. And there is a tremendous amount of stake, right? There's the health of our children and our future generations versus the profits for these corporations. And the lobbyists who work for them are very well funded and they're very effective. And maintaining the line on what that data is and enforcing those ideas is extraordinarily important.
Yeah.
So those are very, very, very tough fights that I'm very much on the side of Ma and RFK in the work they're doing. I'll say. But really, it addresses the whole overall problem that we have in our country of corporate capture of the rules of government.
Yeah.
Right. The gigantic corporations have taken over the way that homes are financed in our country, the way that food is produced, the way that the healthcare system operates. Really, pretty much every opportunity they've had to take something over, they have, and it's to the detriment of the people in our country.
Yeah.
And so we are going to have to go back in there and claw back control of all of these government institutions and rewrite the rules there so that they're working for the benefit of the people of the country, not for the benefit of gigantic corporations that are hell-bent on extracting every dollar possible, even if it's at the detriment of the people.
Totally agree.
Yeah. So that's the mission.
Yeah.
That's the mission.
I mean, it's, I'm not like a stay-at-home mom, right? I work really hard. Like, I run my business. I help my husband run his business. I run for office, the whole thing. And it's a lot. And so, over the last couple of years, it's been a learning curve for all of us to find other resources to be able to get food. And so, like, I have milk delivered from a farm. It's totally legal. It's not raw milk because we're not allowed to sell raw milk here, but and it's pasteurized the old-fashioned way with the cream on the top and the whole deal. But it's taken some time to do the research to be able to like get some like good, wholesome, non-processed foods. I should be able to just go down to Whole Foods and get it.
We'd love to have you over the next time we do one of these Nevada Nutrition Coalition meetings.
Okay.
We'll have you come over, and it'll be a great perspective for people to hear about it from your perspective. Because right now we don't have any moms. I mean, who are exclusively moms, right, or representing the community from that regard.
Okay.
They're all except for maybe the mayor's daughter-in-law.
Okay.
But she's a teacher, so she's the mayor for the school side.
Yeah.
So the other stuff you were talking about stem cells and innovation in healthcare.
Yes.
So, Florida and Utah just passed bills that allow stem cells to be utilized in their states.
Okay.
And so we would like to ensure that Nevada remains at the forefront of that. Nevada's putting up a $10 million grant for Las Vegas is putting up a $10 million grant for biotech incubator.
Okay.
And so I'm part of the committee that's supposed to select who is awarded that grant. I think the award happens in April.
Yeah.
And so the goal for that is I've been pushing that the focus for the first technologies we bring should be on longevity, because we would like to make Las Vegas the global destination for staying young and beautiful forever. We think that's on brand for our city. We have some of the best plastic surgeons in the country right here in Las Vegas.
Yeah.
We have some of the best wound care. Transplant team is good for the immunology aspects of it. If we can build up infrastructure and research regarding longevity sciences, stem cells, and exosomes, that is where all the money in healthcare is going, and research is going these days. And there's such a huge retirement community here. It's so attractive for wealthy retirees to come because we're state income tax laws. We will get a lot of investment, and it'll be really good for Nevada. And now that gaming is something that is becoming kind of ubiquitous across the country. People don't have to fly to Las Vegas if they want to gamble. They can stay local. We do need to have a draw that we can continue to be the destination place for the world to come to. So we'd like to be at a competitive level with Dubai and Tokyo, and maybe someplace in Europe a bit and keep up.
So I'm going to put on your radar another population. So there's always a lot of nonprofits for our first responders, for our veterans, right, to send them down to Mexico to get this stem cell treatment.
This I wasn't aware of.
Yeah, there's and so there's a lot of nonprofits for veterans and things like that to get them down there to do the various treatments, not stem cell and also the PTSD treatment. Okay. But we have an entire population, and it's dwindling, but it's going to get more robust again because we're hearing from AI. They're going to get rid of the programmers, and we have a shortage of contractors, electricians, plumbers. Okay. These guys have been doing it since they were little. Okay. Or younger. Okay. It is hard on your body. Construction and that manual labor is really hard on your body. I know I'm married to one.
I would see a lot of injuries in the workers' comp field.
Correct. And so these guys their bodies break down much faster, and they're just totally forgotten, and they don't have the resources to get these treatments. And if they could, rebuild, have, or at least not have pain in their back and their neck and their shoulders and their wrists, and their knees and actually be able to continue to work longer pain-free, that will be a huge benefit not only to them, but to our community and our infrastructure because we need to keep them working as long as possible. So I'm just going to put that on your radar to make you think about them.
So one of the guys, thank you, because I did not know that about that veteran community that's going down south for these TENS treatments or all the workers' comp people. So you're right, would benefit and be able to get back to work rapidly, which is a big deal, actually. So there's a friend of mine is working with the company that does all the little leagues of baseball in the country, and they're going to put up, I think, about 12 or 18 baseball fields. And they've agreed to have all of the championship games for Little League done here in Las Vegas.
Cool.
So it should bring, they should see about 1.5 million people a year to Las Vegas.
Wow.
Exactly. And so the interesting thing about it is his angle on it isn't even really Little League. I mean, his kids in Little League and they're good at the baseball, but it's he's doing it because he has an exosome company. And he wants to treat all the sports injuries that the kids have at Exosome and sort of, bring this into sort of the standard of care.
Okay.
And so we're excited to help him with that. And so he's sort of wants,
What's exosome?
So exosomes are, so cells communicate with each other sometimes by creating little packets of like tiny little cells about a nucleus or without much in it, except for proteins that are useful for providing growth or healing. That's
Okay.
majority of it.
Interesting.
Yeah. And so you can get them by processing your blood and spinning it down, or you can get them from
Like
tissue. Yeah.
Okay.
Yes.
So my mom, we did that with my mom's shoulder. She had frozen shoulder and she couldn't raise it. And prognosis was 50-50. And I had heard about Dr. Lemper is here at town. Okay. And he was doing pain management and spun off on his own and is doing like the plasma. So and this was years ago. And I said to my mom, I'm like, listen, like it's $1,500 or something like that. Like I'll pay for it. I don't care. That's the worst will be out. Okay. If it doesn't work. Sure. But the surgery thing, like,
Yeah, don't.
Okay. So we went in there the day before. I did the vitamin drip with her the day before together. Then the next day we came back and, he pulled her blood, spun the plasma, put it in her shoulder. And within 5 minutes, she went from not being able to do this to being able to do this.
Wow.
And that was 6-7 years ago. And she's still good.
See, I hear lots of stories like that. When I talk to the orthopedic surgeons who are out there and they talk about what they have in the literature, they're not reporting results like this.
Yeah.
But everybody I talk to who's out in the lay public, and I talk to sports trainers for some sports teams, and they're like, oh, it works. We send the guys down and then they get to sign it. So I don't know why the published data isn't keeping up with the anecdotal reports.
Well, I wonder if people who are seeking this out and willing to take the quote unquote risk tend to be more healthy just in their overall lifestyles. So the success rate is probably good, right? I mean, my mom, outside aisles, right? She's a healthy lady. Yeah. I mean, Dr. Lever was like, oh my gosh, so your blood is so clean. I was like, does that mean? So I wonder if the data is skewed in terms of the antidotal because you're sending athletes and people who are health conscious and are willing to do some alternative measures and medicines because we do take care of our bodies. I don't know.
No, not.
I know we're going on this huge tangent. I don't know.
Vegas is one of the best places for that because we have such a healthy community out there. Given the UFC and everybody's involved and some sort of maintaining themselves in a positive. I say so many people are not everybody obviously.
I mean, you take a look at COVID, the people that were unhealthy, right, or the ones that got hit the hardest. That's true. My mom got it and didn't know she got it. We didn't know she got it until the antibodies, and she was in her 70s. Right? You're hearing oh, it's just killing everybody that's over the age of, 75 or whatever. And it's like, my mom didn't even know I had it. Like a blip on her radar for her.
She's taking good care of herself.
She does. It's amazing.
That's really good. So we're wanting to make Las Vegas a global destination. For that, and I see if there are laws that can be passed to enable us to utilize a World Market Center. World Market Center is an international port, and then international port. That should mean that there are sections within that operate under international law rather than U.S. law. If that's the case, that means that we could have an area right in the heart of the medical district over there that could be utilized to provide, world's most cutting edge therapies that are not yet FDA approved.
And like right to
And
try.
exactly, and give people the opportunity to try it. And so I know John Lobb and those guys.
Okay.
So I said, how about they get a draft of some legislation that we could put forward at a federal level?
Okay.
And so I don't see a reason not to, and not to try to build something to allow Nevada to be the first at doing these things. Because I mean, we regulate. We're the first at doing things here so often, and we do it so well when we do it. Right, with gaming and with THC and with many other things, we have taught the world how to do these things well.
Yeah,
and we can do that again. That's like what I'd like to see.
Good ideas.
We're trying. We're trying. So how do people get involved with their campaign and help you get elected?
So they can go to daniellefornevada.com and go check out my webpage. There's a donate button there, which is always helpful.
Okay.
And then I'm also across all the platforms, and I guess we could probably post the handles at your team.
Sure.
The links.
We'll put it in the caption.
Yeah, you can put them in the caption so you can follow the links. And, follow me on social media. I'm pretty active on there. So it's always good when people comment. And I like all varying ideas. So that's easy. Like I did a series on the Satanic Club at one of the high schools.
Oh, wow. Yeah, that's kind of a scary thing in the world right now.
Well, here's the thing. It's actually like an atheist club, but they called it a satanic club. Okay. But I didn't know that at the time when I was reading, this article and learning about it. But it was kind of a cool subject matter because I'm like, I don't agree with the Satan Club, but at the same time, I believe in protecting our Constitution and free speech. So like, I'm not going to silence it, but I still have a right to criticize it.
Yeah.
And so it was really interesting to see the comments from people because a lot of the high school students, they thought it was okay for them to have their freedom of speech, but not for me to have my freedom of speech, which I think is a generational thing and probably some areas where we're like breaking down in our education, and it is what it is, right? So I like differing ideas. I like the interesting discord and things of that nature. So commenting always helps. And but if you go to my website, you'll actually have my cell phone number there. And 85% of the time I usually pick it up. If not 100% of the time, I'll call you back.
That is fantastic.
Yeah.
That's super great. On the discourse in our country, one of the things that we did that we're doing actually next month is so after Charles Kirk was assassinated, it was kind of the death knell for free speech on college campuses, right?
Yeah.
The place where people are supposed to go to discuss ideas and exchange information in a peaceful and secure environment was terribly violated. That tragedy. So what we thought we would do is we would sort of set an example that the college kids are supposed to be able to discuss these things civilly and appropriately. So we invited down to Las Vegas the oldest and largest debate society in the country to come down here to debate what are the two most controversial issues in the country are at the time.
Okay.
So they should be coming here, I think, on the 18th.
Cool.
And they're going to be down at the law school over at UNLV. And I think there'll be some media down there, and they've opened up to their alumni institutions.
Fine.
So so if you want to go down, let me know.
Yeah, send me the info because I think that sounds great. I think we've lost the art of debate.
Yeah, just so, right?
Yeah.
And so the adults will come and they'll sit and they'll listen to these kids just presenting the facts about these different issues civilly and politely, and everybody will not have to get each other's throats, because I think the audience is so triggered and trained to do that.
Yes.
Right. So it's gonna be an exercise for them too.
Cool. I love that. Good idea.
We're gonna try. All right, listen, thanks so much for coming on the show today.
Yeah, it was fantastic.
Yeah, no,
Interesting conversation.
for sure.
Yeah.
For sure. Well, it's fun to talk to bright people.
Yes, I have. It is few and far between sometimes.
You'll say that.
Yeah.
But here in Las Vegas, it's more common than not.
Yeah.
So that's the truth.
Yes, that is true. So, well, thank you again for.
Thanks so much.
This podcast is a campaign communication paid for by Nagy for Congress and authorized by me, Dr. Nagy. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the campaign or its affiliates. Discussions are intended for informational and conversational purposes only and do not constitute legal, financial, or professional advice. Any references to public policy matters reflect general positions and priorities at the time of the recording and are subject to change based on legislative process and voter input.